今日嘅專家或 expert talk 咧，我哋今日咧就會講一個比較大家將會比較關心嘅 issue 啦，就係講個 healthcare， 就係個 healthcare 嘅 system 嘅。今日我哋請到咧就 CCHP 嘅 CEO Larry 咧嚟到我哋嘅 show。Thank you for coming.
Thank you.
And thank you for coming and to talk about this very important topic. Would be healthcare.
Sure.
Changes. So Trump will be the president next year, and he was saying that one big change that he's going to do is healthcare. Before that, let's talk about your background.
Sure. So I'm Larry. I'm the CEO of CCHP. We're a health plan based in San Francisco. We came out of the need for providing healthcare to the Chinese community that was served by Chinese hospital and its physicians. Back in the day, we were created in 1986 because the Chinese community had a tough time getting health insurance. And so Chinese hospital and doctors wanted to do something about it, create a health plan. So that was back in 1986. So my background is that I've been with CCHP almost 15 years. I'm the CEO. I was the COO. Before that, I did a Medicare Advantage startup in the Seattle market, worked for about 4 different health plans, including Blue Cross Blue Shield plans, a co-op plan. And I also worked for Kaiser for about 8 years in the 90s. So I've seen a lot.
Wow, so over 35 years in this. So that's why we have you to talk about this topic. So what's the main differences between the current Medi-Cal, Medicare?
Right, so I think you've talked about Medicare, Medicaid, or as it's called, Medi-Cal in California, and the Affordable Care Act, which some people call Obamacare. In California, it's called Cover California. So those are all government-sponsored programs that are available to people who don't get their coverage through maybe an employer group plan. So if you're not getting it through an employer group plan, or maybe through a military plan or some other maybe labor and trust or through your union, then these are main options in California. So they're all kind of governed and guided through the federal government through statutes. Let's start with Medicaid. So Medicaid, or Medi-Cal as is known in California, is available to those who are below a certain income threshold, and it's purely about income. In California, that threshold is 138% federal poverty level. So federal means they set some guidelines, and if you fall below federal poverty levels, then you qualify for Medi-Cal. And typically that's going to be a rich plan, no copays, not a lot of cost sharing. Federal poverty level is defined by not just your income, but also how many people in your household. So, you can't just look at the income alone, you have to look at how many people are in your household. And
the savings too, right? I mean,
so that used to be sort of an asset test, but really now it's mostly about income, because they don't want people spending down just to be eligible for Medi-Cal necessarily. They're trying to discourage that. If you make above that percentage and you don't have employer group coverage offered to you, then you fall into the Cover California or the Obamacare. Again, if you're over 138% Medicare, till infinity, you can get coverage through Cover California. What's unique about Cover California is that it takes dollars from the federal government. It's called advanced premium tax credits, and actually it pays for a lot of your premiums. In a lot of cases, with the additional dollars through the federal government, some people can see 0 premiums because they might be just above Medi-Cal and below some other thresholds. So if you're not getting employer group coverage, that's a good choice for them. Then if you become over 65, you're retired, qualify for Medicare, then you can enroll in Medicare, and then there are private plans called Medicare Advantage that people have heard about. So these are privatized Medicare plans that are very good options for a lot of people in the marketplace.
So if you're not over 65, you're still working,
right?
And mainly there's 2 types of people out there. Like, one is provided by company, right? So company, sometimes they pay 100%, sometimes they pay like a big portion of it.
Right.
So, and then the rest they deduct it from the paycheck. And then the other type is like, the company not providing any health care. So you have to go out and get your own, right? So, and then those are the mainly type of programs that people can get, right? If we're looking ahead of 2025, what are the potential changes is going to be?
So if they get benefits through the company, I think there is discussion that, well, first of all, any changes to any of these programs requires an act of Congress. There are some things that the administration can do. They can fund certain things. Take, for example, in the first Trump administration, he decided not to fund a special program in Obamacare, and that caused a lot of health plans to raise their rates because the law required you to still offer these rich benefits. But if the federal government is not paying their share, then it's going to cost a lot more. So there may be some of that happens. We've heard that the President-elect Trump is talking about adding in vitro fertilization. We don't know what that looks like. That's a very expensive procedure. Potentially that might increase the cost of care. In the first administration, when he was through there, they talked about repeal and replace. There's not as much talk about that now. And it remains to be seen whether or not he can get Congress to do something.
He's backing off a little bit now. So.
It's hard to say, but it became a functional program that a lot of people benefit from, quite frankly. On Medicaid, this is where it takes federal dollars and there's matching state dollars. A lot of people are on Medicaid, quite a few people. And so I think people have benefited from that Medicaid expansion. So that was one of the things that his previous administration kind of fought was the Medicaid expansion. But it's been shown that a lot of markets benefited from expanding to Medi-Cal. Why? Because you don't have people who are uninsured. And so, that actually helps the economy, that helps you move, that gives you freedom. You're not locked into a job just to get health insurance. It can create a little bit more freedom for you to start a job or start a company, knowing that you have health insurance to cover things just in case things come up. And so if you're on Medi-Cal or the Affordable Care Act, you don't have to worry about that. Just, and as I mentioned, in both situations, vast majority of the premium for average people is going to be covered.
What is the main difference between Medicare Advantage and also the traditional Medicare?
Right.
I mean, that's two things people are probably confused with.
Yeah, so that's actually a really good question because a lot of folks get their coverage through their employer. And then when they retire, they're like, now what? Now I got to look at all these, and what's Part A, what's Part B? I know I have a red, white, and blue card. Now what?
Home Lam card or
Home Lam card, right?
Home Lam card,
And then it's confusing because you get a lot of mailings saying, "Hey, you're about to turn 65. Now's your time to enroll in all of these things." So let me explain that. So the original Medicare was created in 1966, Johnson administration, and largely hasn't really changed all that much. It was created where Part A is hospital, government insurance, and Part B is sort of physician insurance. Notice I didn't mention prescription drugs. I'll talk about that later. So so when you see the red, white, and blue card, you'll see Part A and Part B. You qualify for those by working a certain amount of time in the U.S.
10 years and
Yeah. So once you become eligible, you need to enroll, and then on Part B, there's actually a premium that you need to pay, and it's based on your income. So that is original Medicare. It doesn't cover everything. Like I said, the program and a lot of how it works hasn't changed since the 60s.
The 60s, yeah.
Right. So it didn't cover a lot of preventive care. It doesn't cover prescription drugs, and that sort of thing. There's no out-of-pocket maximums, as another example. So what happened then is, like in the 80s, when managed care started really taking effect, moving into the next decade, a lot of private health insurance companies said, "Why is Medicare running out of money and paying for all the care to hospitals and physicians when they need better overall care like managed care?" So private health insurance companies made the case to the federal government that we can take those dollars, put in a private health insurance plan, manage their care better, have some savings, prevent the sort of runaway costs of Medicare, and that's a better outcome for the members, and the federal government has less liability. So that's what Medicare Advantage, Part A plus B equals Part C. So in the 90s, it was called Medicare Risk or Medicare Plus C. And so then in the 2000s, that's when the Bush administration, they created the Medicare Part D program, prescription drug benefits. And so a lot of Medicare Advantage plans bundle the A and B plus C, and then add a D. And so that way it's really it's what health insurance to be. It covers hospitals, physicians,
and
drugs, all that. In the 2000s, a lot of good drugs, good therapeutic classes came about, but they're very expensive. And so a lot of seniors couldn't get access to them. And so that's why they created the prescription drug benefit. So it's privatizing all the bits and pieces of the federal programs into private health insurance plans such as CCHP. You still need to enroll in the original Medicare, but then you tell the federal government, you know what, I'm going to assign my benefits to this health plan. And sometimes health plans have additional premium, sometimes they don't. Right now, most plans, I'd say about 80% of plans have a zero premium because they figure out how to make all these benefits that they need in a Medicare Advantage plan.
I see. You think that's going to change?
In the future?
In the future?
Using my crystal balls?
Yeah.
I'd say likely not much change in Medicare Advantage. You know, one of the appointees that President-elect Trump has made is Dr. Oz.
Dr. Oz, yeah.
And in the past, he's been a favorable supporter of Medicare Advantage. I think a lot of seniors, that 55% of people eligible for Medicare are on Medicare Advantage plans. So I don't think any administration is going to tinker with that.
Okay.
They do need to keep watch on the cost of Medicare Advantage and the funding for it. And the types of programs that they're putting into it. But I think with this administration, with who they're recommending to run CMS, it's likely Medicare Advantage is going to be pretty solid.
Yeah, Dr. Oz, and then the second person will be Robert Kennedy. I was about Bobby. He'll keep calling Bobby. What's going to happen on his side? Because he's known for against the vaccine during the pandemic. So what do you see?
Well, that's going to be interesting. I think one of his main platforms is Make America Healthy Again. Which I think appeals to a lot of folks because I think intrinsically, I think we all understand that if you stay healthy and you prevent certain things, to take preventive measures or take healthy measures early on, you prevent a lot of the more catastrophic, acute, higher cost
and the medical costs and
down the road.
Insurance,
Right. I think that's probably a favorable view. However, the Secretary of HHS administers CMS. I talked about CMS's. And manages the Medicare, Medi-Cal, or Medicaid, and also the rules for exchanges or Obamacare. HHS is the bigger organization that includes that organization, FDA, CDC, Centers for, and NIH, and they're the ones who fund a lot of the original research in terms of what goes into medicine and that sort of thing. So it'll be interesting. Robert F. Kennedy is, is probably not the strongest supporter of vaccines, but the science around preventive care and vaccines are pretty sound. So it remains to be seen how that's going to all play out.
Yeah. So, I mean, many employers are currently utilize the ACA, right?
You're
So,
right.
the framework providing health care. So to employers, and how's that going to change or any difference out there?
Yes.
What's the
so
options out there?
Sure. So there's actually two programs that are in Cover California. On the one hand, if there's the individual plan that I talked about, if you don't get employer group coverage based on your income and based on your age and based on the geography of where you reside, you can pick from among these different metallic plans. Bronze is, on average, going to cover 60% of your costs, 40% is going to be out of your pocket. And then there's a lower premium because of that. So Platinum, on average, is going to cover 90% of the cost and 10% is going to be out of pocket. So that's a higher premium because that's a richer plan. So based on your income, you can enroll those plans. There are a bunch of plans in middle called Silver. So if you're between 138% federal poverty level and about 250%, you can get a very rich plan.
Do you have an example on that?
I think for like a family of four, earning $90,000 or less, or less $95,000 less, you can qualify for a silver plan. And with the additional, it's a rich plan where it covers more than the 70%. It's one of our silver plans covers about 94% of the cost. And you can actually, based on the additional dollars that are available now through the Inflation Reduction Act, some members in the silver subsidized plans are getting zero. Now that's what, I think you asked the question about what's going to happen in 2025. That program funds run out at the end of 2025. Right. So
who knows?
Who knows if it may become so popular that they have to vote to fund it again.
So what about to employers?
So employers. I'm sorry. Thanks for the reminder. So on the employer side, one of the things that the Affordable Care Act also did was to reform small group coverage. Remember I said in the early days, before the Affordable Care Act, health plans could put limits on things, lifetime limits. Maybe $1 million. Back then, $1 million seemed like a lot. Today, it could be a critical case. It could be, a premature baby, in the NICU for a couple of days. So the Affordable Care Act covered broader services and guaranteed issues. So if you're an employee, you're granted access to that. What they also did was sort of standardize the metallic levels and allowed a small business. So in the old days, in California, we actually were able to had guaranteed issue since the 90s. So small businesses, for one small business, you have to offer all your insurance products to every small business. So we had guaranteed issue in California, so that wasn't as big an issue. But the exchange allowed for a small group to get all their employees into different health insurance plans. So once you go onto the exchange, you could get Health Net, Kaiser, Blue Cross, whatever. We were on the exchange, but we chose not to be on the small group exchange anymore. So that is a benefit. There was a tax credit given to employers for a bit. That's since expired. But it allowed small businesses to, offer them more than one plan to their employees. So that was a benefit. So,
do you think it's very hard to change within the next couple years because it's so like what we were talking about? It's so complicated.
I think there will be changes. The healthcare in general is probably one of heavily regulated industries. I think that the administration will politically want to do something to prove that they're doing something. With control of the Senate and the House, they can do some budget items to say that they're doing something. They can improve something here, make something more restrictive in another place. So I don't think there were clear. I don't recall any clear, definitive statements of what they were going to do. If they were not as strong in a position of repeal and replace like the first Trump administration.
I see.
So, but I do see that they're going to focus on making sure that costs don't continue to go up.
That's true. That's a good thing, right? Costs don't go up.
Well, I hate to break it to you, but costs are always going to go up. So
it is.
The best news I would say is that there's so many different options. Most people should have an option to get coverage. That's one of the best things that's happened in the last 10, 20 years.
Yeah, especially when the Obamacare and all those Medicare roll out. And so, hey, thank you so much for your time today.
You.
And hopefully we can come back again and we can talk about different things in the future. Okay?
That'd be great.
Thank you
That'd be great.
so much.
I appreciate it. Thank you.